Myra Levine and the conservation model. Myra Levine was born in Chicago, Illinois on December 12, 1920. She was the oldest of 3 siblings and grew up during the late Depression, with her mother and father struggling financially. Her interest in nursing developed from watching her mother care for her father, who was always suffering from stomach problems. She married her husband Edwin in 1944. They were married for 50 years and had 3 children. She died in 1996 at 75 years old. She completed her diploma in nursing at Cook County School of Nursing the same year she married Edwin in 1944. She worked as a private duty nurse and a civilian nurse during World War II. She then went on to get further education by obtaining her Bachelor of Science and Master's of Science. When working as a director of nursing at Drexel Home, a geriatric facility, she watched patients struggle with terminal diseases and began realizing that the nurse was an integral piece of patient care. When working as an educator and professor, which she did for around 30 years, she designed different courses and curriculums. When creating her syllabus, it actually became her first publication where she addressed her vision of nursing theory. She was a hard-working and dedicated nurse, so it's not surprising that she received many awards and recognitions for her work. Here's a list of some of her accomplishments along the years. Her past experiences as a nurse, patient, and human being really led to her development of her theory. Growing up through the Great Depression and seeing the struggles, seeing the terminal illnesses and patients suffering as a nurse, and also when she was a patient herself. Levine suffered the loss of her first child just 3 days after birth, and was totally avoided by nursing staff because they were taught not to interfere with the grieving process. All of these different interactions made her realize that nursing is a human interaction, and she began to create her theory around these points. She came to the assumption that ultimately the decision for nursing intervention must be based on the unique behavior of the individual patient. As she further developed her theory, she revisited the previous works of Florence Nightingale, who showed her that the nurse creates an environment that healing can occur, Claude Bernard, who helped her see the differences between external and internal environments that the individual experiences, Tillich, who wrote several books about the concerns that drive humans towards confrontation, Cannon's definition of homeostasis, and Conrad Waddington's concept of homeoresis. Levine's nursing theory is based on 4 major principles. The principle of the conservation of energy states that the human body functions by utilizing energy, and we need energy going in order to allow energy going out. The conservation of structural integrity states the importance for the human body's physical boundaries that has to be maintained to facilitate health and prevent harmful agents from entering the body, like your skin and mucous membranes. The conservation of personal integrity is the concern of the client's personal self, their identity of self, their self-worth, and self-esteem, and that it has to be preserved and enhanced by nurses, so the interventions need to be a positive reinforcement. And finally, the social integrity of the client that reflects the family and community in which the client functions, the client support system. These core principles help to drive the nursing interventions and highlights different needs of patients in Levine's conservation model. Levine's concepts encompass the requirements of the nursing meta-paradigm. The nursing standpoint is covered within the conservation of energy, health within the conservation of structural energy, the patient within personal integrity, and the environment within social integrity. Her work has a clear domain, and each concept represents a unique perspective for nursing practice. Her model is neutral and can be applied to many different aspects of nursing, including education, multiple different nursing specialties, and future research. Before further explaining her 4 core concepts, we need to discuss important assumptions about the nurse and the patient or person. She assumes that each individual is an active participant in interactions and is constantly changing to the life around them and will continue to change over time. This is depicted in our diagram by showing the equilibrium state with a dashed blue line, the green line showing the initial change towards too much, too little, or some extreme. The person then has the ability to intervene or adapt as they return back to integrity or wholeness. This is the process of adaptation. Because of this process and how every person's process might be a little different, Levine makes the point that nursing intervention needs to be based off of the individual and unique behaviors of the patient, and that patient-centered care means individualized nursing care. Now, when applying this to the conservation of energy, Levine argues that the nursing interventions need to be based on the specific problems of that specific patient. For example, 2 patients could come in with problems of using too much energy. One could have a fever where they're using too much energy trying to fight off the infection. The other person who's coming in with the same issue of using too much energy could be related to overexerting themselves. Their nursing interventions will be different because the patient's experiences and the patient's individualized experiences are different. And that is Levine's whole point. When going to structural integrity, it's the same issues where the nursing intervention needs to be based off the person's interventions. Same with personal integrity and social integrity. The one issue with social integrity that some people forget about is that nursing, when we're caring for patients in the hospital, tend to cause patients to be alone and away from their family and structure and support. So it's up to nurses to identify and realize that they may be the cause of the problem and intervene by promoting family interactions, giving support groups, or having support groups within their hospital to help get the patient back towards the equilibrium or their wholeness. Another concept of Levine's theory is the idea that the environment helps to complete the wholeness of the patient, and that the person is made up of external and internal aspects of the environment they are currently experiencing physically and mentally. And also they are made up of their past experiences as well. This all plays a part into the person's holism or their response to future stimuli in the environment. Levine argues that nursing interventions and patients' or persons' specific adaptations should be specific to the experiences in the environment and the person in the environment. Tying together all of her major concepts, we get her complete conservation theory. This diagram that was created by our group helps to depict that each of her 4 main concepts of energy, structural integrity, personal integrity, and social integrity all change or adapt within the person's internal and external environment. So that way nursing interventions need to be specific to the person's change, the person's environment, and what the person is going through. This all helps to relate to the person's ability of being whole, or the whole process of the person. Her theory is very useful in nursing because it really helps to emphasize that each patient has a different background, different ethnicity, sex, religion. So nursing intervention needs to be specific and unique to that person. When thinking about ways that nursing can intervene, we help to kind of show you the different 4 major principles and the different nursing interventions that can apply. You can conserve energy by helping the patient with mobility, walking, getting them comfortable. Conserving structural integrity through protecting against skin breakdown or skin injuries and turning and repositioning the patient. You can conserve personal integrity by addressing the patient's emotions and helping them with coping skills and positive reinforcement techniques. And social integrity through identifying support structures, providing them resource, support groups, and giving them and promoting them to bring in visitors or family. Now let's try to use Levine's theory on an example case. Mrs. Smith is a 30-year-old woman recovering from a colonoscopy. Although there are some surgical concerns that are probably identified through structural integrity, she needs all realms in order to go back to being a whole, or back to her wholesome self. She needs to conserve energy while she recovers. She needs to care for the stoma site. Nursing needs to help address and go over emotional concerns regarding having a stoma bag in her life and provide education about her lifestyle changes. And the nurse also needs to get the family involved, help them on the postoperative care and needs of the family, and maybe introduce Ms. Smith to some support groups so she can meet and identify some people that are going through the similar experiences. Park, Chung, and Lee conducted a descriptive study including 494 patients with advanced cancer to try to determine the predictors of quality of life in patients with advanced cancers. They looked at the physical needs, but also social, psychological strains were also examined. They found that the quality of life deteriorates when a person is experiencing difficulty in performing daily activities. This is related to Myra Levine's conservational theory because it shows that cancer, one unique diagnosis, can cause multiple different forms of suffering, including all four of her principles, but also shows you that each individual patient with the same one diagnosis can be complaining of different stressors affecting their life. So it's up to nurses to assess the patient, assess the environment, assess all four of her core principles, and provide unique and patient-specific care. And that's what Levine has to say with her theory. Her theory is very simple but also complex, but it makes it pretty easy to use for each concept. The couple of issues we had with making it a little bit complex was that it's hard to apply maybe all four principles to some simple things, and also there's interconnected themes within her four core principles just because they're so broad. But she uses easy universal language and she has multiple categories, which makes it very easy to use her theory. There's great value to nursing science within her theory, especially the concept of holism that is now largely used as a model of nursing. Patient-centered care helps promote wholeness by realizing that everyone has different needs, so the nurse must tailor her care to each individual patient. There will always be a better way nurses can help, so we need to continue to research and use her model to strive towards that. One middle range theory that was impacted by Levine's theory was the transition theory by Alpha Mallius. She noted and described interactions between the nurse and the patient, noting that the nurse should be concerned about what the patient is experiencing and as they process the journey and endure the changes they encounter. This is connected to Levine's theory because it addresses the need to be concerned with the emotions around change and be specific to the patient instead of just a universal approach to the same issue. And that's the whole thing. Here are the resources we used, and thank you for listening.